Dressing. Learn if your loved one has any moving and/or positioning restrictions. Wash your hands. Explain to your loved one what you plan to do. Respect the person's privacy and keep the person covered with a sheet. Have the person sit up in bed and undress starting from the person's strong side first. If the person is limited in movement and cannot sit up in the bed, use the turning approach. On 3, place the person lying on his or her weak side, leaving the strong side up. If the garment is a button-down, unbutton and slide the garment off the strong arm. Roll the removed garment to the bed near the person's weak side. On 3, turn the person over to the strong side, leaving the weak side up. Remove the garment from the weak side. If the garment is a pullover, on 3, place the person lying on his or her weak side with the strong side up. Pull the garment up along the strong side. Pull the strong arm out, placing the removed garment on top of the strong shoulder. On 3, turn the person over onto his or her strong side with the weak side up and move the weak arm out. Then remove the garment gently over the head. Pants are removed the same way from the side lying position. With the strong side up, unbutton or unzip, then pull the top pants side down past the hip and buttocks. On 3, turn the person with the weak side up and pull the top pants side down on the weak side. Pull the pant legs down, bundling them up as you go. Lift one foot up at a time and pull the pants over the foot, making sure not to cause friction to the heel. A simpler procedure may be done if the person is able to arch his or her back. On 3, as the person arches, pull the pants down below the buttocks. Then bundle the pant legs down and over the feet, careful not to cause friction to the shin. Dressing. Learn if your loved one has any moving and/or positioning restrictions. Wash your hands. Explain to your loved one what you plan to do. Respect the person's privacy and keep the person covered with a sheet. Have the person sit up and dress from the weak side first. If the person cannot sit up, count to 3. Place the person lying on the strong side, leaving the weak side up. If the garment is a button-down, place the garment on the weak arm. Straighten and pull the garment down, then place the remaining garment rolled near the strong side. On 3, turn the person over onto the weak side, leaving the strong side up, and place the strong side arm into the garment. On 3, lay the person on his or her back and button up the garment. If the garment is a pullover, place the garment gently over the person's head. On 3, place the person on the strong side with the weak side up. Put the weak arm in through the garment. On 3, turn the person over to the weak side with the strong side up and put the strong arm through the garment. Pull the garment down. With pants, the pant legs are bundled up and placed over the feet carefully, not to cause friction to the heels. On 3, place the person lying on the strong side with the weak side up. The pants are pulled up over the weak side's buttocks and hip. On 3, turn the person on the weak side so the strong side is up, and then pull the pants up on the strong side. Zip or button up the pants. A simpler procedure may be done if the person can arch the back. Bundle the pant legs and carefully put the pant legs on over the feet. On 3, as the person arches his or her back, pull the pants past the buttocks. Zip or button up the pants. Using a bedpan. Learn if your loved one has any moving and/or positioning restrictions. Wash your hands. Explain to your loved one what you plan to do. If the person is continent, has control, but cannot get out of bed, or it is too hard to get out of the bed and use a toilet, a bedpan is used. You need a clean warm bedpan, gloves, wipes, toilet paper, and a changing pad or a bath towel. Put on gloves. On 3, place the person in the side lying position. Place a changing pad or towel on the back side of the person, so the top lies at the waist and the bottom lies at the thighs. Leave some excess changing pad or towel, fan folded or rolled, near the edge of the buttocks. On 3, turn and roll the person over onto the other side. From the other side of the bed, pull the excess changing pad or towel straight. Have the person lie on the back and place his or her knees up and feet flat on the bed. Place your hand underneath the person's lower back and have the bedpan ready to slide under. On 3, have the person push his or her feet down on the mattress, arching the back and pushing up the buttocks. Help the person by lifting up on the lower back. Slide the bedpan under the buttocks, making sure the anus and urethra are centered over the pan. Give the person privacy. If the person can wipe him or herself, leave toilet paper. When you are called for, come back. Have the person arch and raise the buttocks, then carefully slide out the bedpan. There is another approach if the person cannot lift up the buttocks. On 3, place the person on his or her side. Place the bedpan on the center of the buttocks. On 3, have the person lean back as you push down on the bedpan. Push the pan between the bed and the person. Once the person is completely on his or her back, make sure the bedpan is centered. To remove the used bedpan, securely hold the bedpan and carefully on 3, turn the person on his or her side away from you. Remove the pan. If the person cannot clean him or herself, turn the person on his or her side away from you. If the person cannot wash, wash from the front down toward the buttocks. On 3, turn and roll the person over to the other side and remove the changing pad or towel. Take off the gloves and wash your hands